Super. Thanks, Nadine. And the challenge of interoperability, I think, is something that maybe we can delve into a little bit further in a few minutes, just to think about what are the kind of things that we can do as leaders to help make that work. Joe, how about you? What's your perspective on successes?
Yeah, absolutely. So just to give some context, very much in same as Nadine and Jack in terms of what happened through the pandemic, but just to give some context in terms of where we've been, particularly with my customer, they're just celebrating their 160th year, in the industry. And that's led to challenges, certainly from an IT perspective, legacy systems, legacy processes in all of that. So our challenge has been about how do you elevate that and move that forward, but bring the customers on the journey, which I think is what Nadine was talking about there as well, very much with the clinicians as well, bringing them on the journey and being part of that. And that's the same with us for the, the end customers. COVID actually just accelerated all of it. And actually what we saw in terms of our successes, actually taking customers through that online experience. We saw 90% of our customers choosing the online channels and the omni channels as well. So I think it's really important that when you look at the experience of your clinicians or your patients and for me the end customers, it's about those different channels that you're creating, and having the tools and the technologies, and there's a lot of it out there, yeah. And it's driven by data, back to what Jack was saying, AI and that data is so important in terms of, understanding that data. For us, it was about the customer experience, and that's where we got our data from. So, we went out to real life customers, we talked to live customers about what they were wanting. And we have some of those customers who aren't able to be digitally enabled. So how do you support those customers? So the challenge is really the balance of, the world is accelerating and it's digital. COVID has taught us that, it's brought some massive benefits, but also the challenge of how do you keep that acceleration? And I think that's the key for me, is the acceleration, the sustainability of that moving forward as well. And bringing everybody on that journey and having that alignment. Yeah, we've had some great successes across the business in bringing our clients and our customers through that digitalization, as I say, really legacy systems and processes, and to get 90% online has just been a tremendous success. But it comes back to the ambition, yeah, it comes back to the ambition, it comes back to the vision, setting the right goals, and communicating that and bringing people along. So, that's a key part of successful delivery and successful transformation. I think the challenge is how do you sustain that? And also in our world of decarbonisation as well, there's a big focus around driving the right footprints from a technology perspective, from decarb and that social value and that sustainability moving forward. So yeah, I think very similar experiences with COVID, taught us a lot, and it's really highlighted the appetite for people to go into that space, but also the challenges that we're going to have moving forward as we continue digitalizing, and the demands, yeah. Customers are demanding, they've got the appetite for that. Amazon's a great model. People want it here, they want it now, and how do you deliver something that allows that pace, but also supports those who aren't able to go on that journey.
Super. Thank you very much, Joe. That's really interesting. I was struck there about you talking about the importance of that ambition and having vision for where this is going and building on the momentum, particularly around what's happened in the last 2 years coming out of the pandemic, which has been a real compelling driver towards digital. So with the benefit of hindsight, particularly over the last couple of years, comes that a benefit of 2020 vision. So what have you discovered as a leader within this digital transformation environment that might help us as a community to be even better at leading digital change in the future?
Is that to me then, Will?
No, you start, Joe. You go for it.
Yeah, okay. So, you know, other than the power of having a crystal ball, which we would all love, yeah, I think for me, the hindsight is actually very much about bringing people on the journey with you and being really, really clear about the goals that you're setting and communicating those. Yeah, I think through the pandemic, going back to that, we all had to move at pace, you know, and you know, that pace, I think for me, we lost people along the journey as well. And so the whole sort of cultural shift in that, you know, if we'd had a crystal ball to say this was going to happen, and actually we need to bring, you know, cultures, people along the way with us, I think that certainly would have made my life a lot easier. You know, and certainly from a financial services perspective, it would have made life easier. So, you know, I think there's a big part around, you know, learning the lessons that, you know, culturally, people, and bringing, you know, and again, I come back to customers, I come back to patients, clinicians, you know, all the same, bringing them on the journey is so important, and going through that cultural change. I think the other big thing for me as well, in terms of hindsight, is that I call it not eating the elephant all at the same time. Yes, and break it down into smaller chunks. You know, the ambition and the vision is incredible, but you've got to be realistic about what you can deliver, how you can deliver that. You know, have a really clear roadmap as well to deliver that, so that you can celebrate the small successes along the way. You know, because that's success, and celebrating that success breeds success as well. And you see those smaller journeys and that coming through. You can celebrate that with the people who are on the journey with you. So I think, you know, don't be too ambitious, I think, is a big learning for me. You know, and break that down and bring people along the way with you, and be realistic about what you want to achieve and the when and how you're going to achieve it.
Great, thank you, Joe. And Jack, how about you? What's your thoughts on the benefit part?
Yeah. I think Joe makes a really good point. I think I think my main reflection, which is sort of is all around that theme of how do you evolve the people model alongside the digital one. I think actually we can put technology in, and we can change the way in which we interact and the way we do business fairly rapidly, particularly when you've got a driver like a global pandemic to work through. But but actually the people model and the stuff that sits behind it needs to then follow on quite quickly. Ideally you do them simultaneously, but in the current circumstances you don't always have that opportunity. So primary care is a really good example. We had brought on a whole new digital way of accessing GP services across the country, and it created a whole new sort of channel for people to work through, and it brought on a whole new level of demand. So actually we saw a lot younger people, a lot more working age people accessing services through much greater with much greater convenience, but we didn't evolve the people model to keep up with that. And it's a similar sort of journey to what banking has been on as well. Actually, the role of the local branch changes. Each local branch doesn't deliver its digital, its digital service. That's much more centralized. It's got much more scale. It allows it to deal with that different level of volume. And I think we'll need to play quite a bit of catch up on those side of things. We evolve the people, the capacity, and the infrastructure to now sort of catch up with the digital footprint that we've created.
Thanks, Jack and Nadine.
I promise everyone that's listening, we haven't kind of colluded on the answers to this, but I mean, my reflections are very similar. I think Spirit as an organisation is in a unique position because we're a provider into the NHS, but we also provide NHS services. So we have people within our team who are users of our own products, and that's super helpful because they are very honest, sometimes brutally so, about what works and what doesn't work. So that gives us that opportunity to do some of that feedback. The other thing that I would encourage everybody to do, and has been helpful for us, is understand what, so the NHS has lots of processes and lots of forms to complete and templates and business cases and all of those things. Some of those have been suspended during the pandemic, and I think there will be a refreshing lightening of some of that administration burden. Maybe not an elimination of it, but maybe a lightening. But understanding what documentation needs to go around a new process to support those clinical teams to be able to feel safe, that they're delivering the right care, and also for everybody to know what it is that they're doing. So back to Jack's comment about the people journey, we've created a number of template documents. So we're not telling our customers what they need to do, but we're giving them as much help as we can to make it as easy as possible for them to do the relevant documentation. So whether that's data sharing agreements or operating procedures or business cases, things like that, where because we've done this 3 or 4 times ourselves, we're sharing that knowledge and that insight, and in some cases doing the first draft on behalf of our customers, so that we're taking the pain out of the change in the process as much as possible, and that has been really helpful in terms of doing that. The only other thing I would say is what we found is clinicians love to speak to other clinicians that have used the technology and found it useful in a peer-to-peer way. So facilitating that is really helpful, but not too soon, because then it comes across as really salesy, and that can turn people off the implementation of change. So it's about a balance.
Super, thanks Nadine. And there's some really interesting themes coming out of here, which I kind of want to explore a little bit more. So we've touched on maybe the challenge of interoperability, the importance of bringing people along on the journey, whether that's the patient, the clinicians, the partners you're working with, we've also talked about this evolving the people model, what's needed there and how that works. So just thinking about, let's start with that interoperability piece. When you're thinking about how to lead for better interoperability, what works there for you? What works, and what are the challenges, and what works?
So I'll try to start on that one, because I think we've done quite a bit on this. I think there's a few sort of critical steps. I think first, making sure everybody, when you're talking about the sort of big programs across organisations, making sure you've got a really good aligned vision and ambition and objectives where you want to go, that all of your senior leadership are entirely signed up to that people are bought in and formally committed. I think you need to build the right capacity and capability to enable you to deliver. If you try and do big interoperability stuff on a shoestring or in your spare time, you're invariably going to fail. So you do need to resource that program properly. You have to have the right leadership and capability in place. I think there's then about being clear in terms of what your requirements are and what you're trying to achieve, and then building the right sorts of partnerships to allow you to succeed. So I think and that's quite difficult, particularly in the public sector, because you do have quite stringent rules around procurement and your ability to explore different projects, and we're trying to move away from that a little bit into more of a space of forming the right strategic partnerships with good organisations in a range of sectors that allow us to bring expertise in that way, and that I think gives us a bit of a different perspective. And then I think being really clear on where you're going to see the benefits realised from the off as well. So I think we're putting quite a lot of interoperability systems that are supposed to solve many problems, but being really clear on what those problems are, how that's going to improve the people's experience, how that's going to improve the productivity of the workforce, what's that going to do in terms of financial return on investments. All of that needs to be really sort of clear in the mind up front, I think.